Hello, everyone. Thank you for joining us today on our new session of the GuestC webinar series. Today's session is on formulating a qualitative evidence synthesis research question. To start, let me remind you that this GuestC webinar series aims to provide the GuestC network members with a platform to share experience and expertise in evidence synthesis and to learn about potential collaborations. As you realize, we are all unmuted when the presenter starts talking, so if you have any question or comment, please use the question tab on your right to send us your questions or comments. You can also use the raise your hand option, and we will unmute you so that you tell us your question or your comment live when we open space for discussion. Today's presenters, we have Professor Natalie Leon and Dr. Karen Daniels. Karen Daniels and Natalie Leon are senior researchers in the Health Systems Research Unit of the South African Medical Research Council. Both work to promote a health system-wide perspective to the primary and secondary health policy and systems research projects they are involved with. They are engaged in qualitative evidence synthesis studies on health policy and systems that have contributed to WHO guidelines. They are interested in developing health policy and systems research capacity to strengthen qualitative evidence synthesis work, especially in low and middle income countries. Natalie and Karen, thank you for joining us today. I will turn the screen to you now.
Okay. Thank you, Tamara. So welcome, everybody. I'm Karen Daniels, and I will be just starting with just a little bit of introduction to qualitative evidence, after which I will hand over to Natalie. With me today, there's myself, Natalie, our colleagues, Liam, Sarah Cooper, and Klengiwe Malloy. So we're all present and very, very excited to be here. And I see our colleague Ari Odendaal is also joining, but he is joining from another city. Okay, so just to start off with, to situate our presentation, what we're going to do is a general introduction to qualitative evidence synthesis. I will just do that very briefly, and then an introduction to question formulation for qualitative evidence synthesis. But it's situated within our experience health policy and systems researchers. And I'm saying that because I know that people within the network are not necessarily all working within health policy and systems research, but it also contextualizes the approach that we're taking to evidence synthesis and to health policy and systems research. So firstly, that policy and systems research, it's a multidisciplinary field, which is distinguished by the questions that are addressed through research rather than a particular discipline-based or set of methods. It includes research that focuses on health services as well as health promotion in general. It includes a concern for global and international issues. It also encompasses research on policy, so that's particularly important, and it promotes work that explicitly seeks to influence policy. So a qualitative evidence synthesis that we're engaging in, we're particularly wanting to influence particular policies or to be part of a particular policy process. Okay, so then just to recap for those people who attended Jane Noyes' seminar, and also for those who haven't, just a recap of what are systematic reviews. So they are a form of research. It's a way of bringing together what is known from the research literature using explicit and accountable methods. And the term systematic review distinguishes them from reviews which are undertaken without clear and accountable methods. So I think many people on the call already are familiar with it, but what we're saying is that it's different to a general systematic review, or a general literature review, such as that you may do for a background of a paper, or you may do a literature review for your PhD thesis. In those, you don't have to show where you got the material, etc. systematic reviews are very, very accountable processes. You need to say which databases you searched, how many you found, etc. Okay, so then within there, there has been a growth over the past 20 years of a range of systematic review approaches and techniques. But still, despite this, this field has been dominated by methods for statistical meta-analysis of controlled trials for effectiveness interventions. Systematic reviews have come under a lot of flack because people say, well, they're so narrow and they only look at effectiveness and they strip away the context. And what do we know about the conditions under which the interventions take place? So increasingly, therefore, there has been some attention to methods that extend effectiveness reviews with information from qualitative studies, as well as conducting reviews of qualitative studies, empirical and theoretical, as standalone. Okay, so qualitative evidence synthesis, therefore, are either an extension of an effectiveness review, or they are qualitative systematic reviews or qualitative evidence syntheses that are simply a standalone. They exist just in their own right as a piece of secondary research. Okay, the key differences between quantitative and qualitative research, and I won't spend too much, you can go back to this slide, but firstly, the key difference in the aim is to measure in a quantitative review, whereas in a qualitative review, you really are trying to understand meaning, experience, theory, etc. A quantitative question might be, how effective is intervention A versus intervention B? Whereas a qualitative question would be, how is a particular intervention experienced in different contexts by different populations? So we can take an example of, say a TB vaccination. If people in Lebanon are having the vaccination as compared to people in Alaska, how is that experienced? What is the difference in their health system? Or even if we went to two islands, if we went to, say, an island like Samoa and an island like New Zealand, which are close together, but they have very, very different, so they have some similarities, but very different health systems, very different resource access. And so one then finds studies from one context, finds studies from another context, and one compares them, okay? So those are the basic differences. Then in terms of conceptualization also, one can have aggregative reviews and configurative or interpretive reviews. Now, in aggregative reviews, as you'll see in the picture, they stack. So you'll find one thing and then you add to it, you add to it, you add to it until you get a, so you're aggregating. It's one on top of the other. Configurative, you actually create an entirely different picture from what you found. You look at the data and you reinterpret based on when we put all these things together, what is the new picture that we find? Typically, qualitative evidence synthesis, therefore, are more interpretive than aggregative, though they can also be aggregative, and of course, quantitative reviews can be interpretive to a degree as well. Qualitative evidence synthesis also attempts to answer what is the meaning or process or phenomena for the people involved. How has the process or phenomena been experienced? Okay, so this is typically what you're trying to answer. What is the meaning? How have people experienced it? Typically, these kinds of evidence syntheses allow for multiple perspectives to be heard. So rather than just one particular line, it worked, it didn't work, people will be talking about what worked about it. Others offer rich contextual information about the setting in which the intervention was implemented. They also move from did it work or not to how did it work? Why did it work in the way that it did? What facilitated gaining the best from the intervention? What factors hampered implementation? Okay, so we're getting a picture of this straight effectiveness. we're just saying, did this vaccine work or not? Qualitative evidence, we're looking at that vaccine in multiple contexts, different voices, we're drawing it together, we're getting a picture, but it's still based on primary studies. It's not based on primary qualitative studies. Okay, and that's the end of my little story. That was just the introduction. So a few references that you can follow up. You will get the slides from tomorrow afterwards. And I now hand you over to my colleague, Natalie Leon.
Okay, welcome everyone. I'm Natalie Leon, and I'm going to talk about formulating qualitative evidence synthesis, or QES, research questions. And,
Natalie?
Pardon?
Yes, I'm going to stop you for 1 second. We've had some
Okay.
comments that some people are not being able to hear well.
Okay.
Can we please send us in the questions tab whether or not you can hear? Were you able to hear Karen? Okay, so it's all going well. The majority said yes. Okay, thank you, Natalie. Please go on.
Okay, so welcome again, everyone. We're going to talk about formulating qualitative evidence synthesis questions, and we'll first talk about the range of possible areas of inquiry. Then we're going to look at the nuts and bolts of formulating and finding the question, including tools for framing the questions, as well as, if we have time, we'll talk about large models as one of the tools, and hopefully we will have sufficient time for discussion. So possible areas of inquiry, as I've said, as Corinne has said, that it's about meaning and so on, but there are really multiple areas which we can talk about, including feasibility, appropriateness, meaningfulness, implementation, equity. And I'm just going to touch on a couple of these questions, and the next slide actually has a wider range of questions in these areas that you can read on your own. So for instance, under feasibility, you can ask questions like, is the activity or intervention physically, culturally, or financially practical or possible within a given context? Under meaningfulness, you could ask questions around what are the experiences, perceptions, opinions of the target group. And this is a very common area of inquiry for qualitative evidence synthesis, but not only one. Under implementation, you can ask questions such as, what is the process for delivering the intervention or the program? What are the intervention components, and how do they work together to produce an effect? Equity questions, though less frequent, also can be answered in a QES way, such as asking in what ways did the intervention reduce unfair and avoidable or remediable differences in health among social groups. Previous slides for you to read on your own, and you can see the multiple questions, not just meaningfulness questions, as we often think is the limits of QES. Talking about the nuts and bolts of formulating the refining question and refining the question, I think the first thing to ask yourself is, what is a good question? And the question is really, what is a good research question? Because it's the same answer also to say, what is a good QES question? The question is related to what you really need to know about your topic, and that can actually be remarkably difficult to determine sometimes, as we'll show you later. It needs to be an answerable question. It must be specific and focused. And importantly, it must have not recently been answered by anyone else. So you need to go and check the literature. Has this review been done? Has it been done in the last 5 years? If not, does it now need updating? The question guides the search strategy and the data analysis. So it's very important to figure it out early in the process. And I cannot stress that enough, because if you don't do this, you will be wasting your own time, resources, and money, and that of the people who are commissioning the research. QES questions do have important differences, though, from the ways quantitative systematic review questions are constructed. For example, questions do not have the tight focus on assessing magnitude or effect of interactions of pre-specified constructs. As Corinne has pointed out, we're not looking at what is the size of the effect of intervention X on outcome Y. Questions are also more exploratory in nature, asking what, why, when, and how does it work questions. Meanings and perceptions are important issues, but they are not the only questions usefully addressed in QES. So, like for qualitative research, QES is not only opinion research. QES may change during the initial, the question may change during the initial formulation phase, and it might further shift and evolve during the research and review process, much as is the case with primary qualitative research. We have a long tradition of asking rich qualitative questions in health policy and systems research, as Corin has alluded to earlier. But there is a tendency towards seeing QES as only about acceptability and feasibility research. These are important questions, but it is important also to expand the range of questions that we can ask QES in health policy systems research. And I have pointed out in my very first slides the 5 or 6 domains that we're talking about. However, you can also help situate your questions by asking where in the policy cycle might qualitative evidence synthesis findings be useful. So I'm not going to go into every element of this stage of the policy cycle, but looking at the first block, if you're in an early policy development stage where you're exploring, understanding, and diagnosing the nature and the scope of the problem or issue, in the next block, in the neighboring block, you want to speak to people more generally about their views and experiences of the problem and different stakeholders of the problem. You might want to understand more why the problem has arisen, you might want to understand or frame a particular problem conceptually more. So your questions will be shaped by that. Looking at right at the bottom of the slide, if the policy is in an advanced stage of having been implemented, you might now want to monitor the effects of that policy option. And so your QES questions might have to do much more with what factors influence how the policy is being implemented, what is the fidelity of the implementation process, are there unexpected and adverse consequences, for instance. So basically what we're trying to do in the steps of question formulation is to start off by framing the question, and this is just generally about making sense of the problem that the QES is trying to address by asking a question like, what is the problem? But then asking on further questions such as, what aspect of that problem will the QES question be addressing? So often in complex health intervention questions, the question might be very broad. It might actually have multiple questions rolled into one. It might have several subdivisions, and your job as a researcher in conjunction with the commissioners of the question is to unpack all of it before you start. One way to do that is to refine the question by looking and understanding the context. What is the QES aiming to achieve? In what setting? Are we talking globally? Are we talking LMICs? Are we talking all levels of healthcare or only some? What perspective are you trying to address? Is it a management perspective, a user perspective? Who is the audience and eventually the users of this research, and what would be useful for them to know? Another way to refine the question is to understand the relationship between the problem, the evidence base, and the outcomes. And that is, you could usefully use a logic model to do some of that. And if we have time, I will touch on it. But I think one can have a whole webinar just on logic models. But in the context of this presentation, it's really just an additional tool to help you sharpen, shape the question that you eventually will look at. So in addition to what I've just said, you also need to be scoping the existing evidence to clarify the amount and quality of the literature that's available, to see whether the question's been answered fully, partially, what the gaps are that have been raised in previous literature, and whether your QES can respond to those gaps. What is the topical and disciplinary focus of that literature? So for instance, if you have a question about health management, you might end up having to look not only in health management and health research, you might have to look at business research, social science research, organizational development research. And you're also looking for key theoretical and conceptual frameworks relevant to the topic, because as I will explain later, this can help you to shape and unpack different components of your question. It's important to explore expanded, refined, alternative formulation of the question. And you can do this by checking in with the stakeholders. People who've commissioned you to do this review, go back to ask them, is this what you mean? If we narrow the question like this, would it still suit your purpose? Do you need to expand this question? And the users also asking the policymakers, you know, in the process of refining the question, this is how it's shaping up. Would this be useful to you, or is it too narrow? What would you like to see in this question at the end of the day? And again, the issue of using a logic model, but also a question framework, which I will focus on now, which is a common tool that's used in research, systematic review research, which can also be applied here. So before I do that, I'm going to try and I'm going to give you a case study that we're working on, which will help to apply some of the knowledge I've shared so far and what we're still going to talk about. WHO, following requests from multiple countries for evidence on whether digital health or e-health and m-health interventions improve healthcare services and health status of the population, started a process of formulating questions for a series of systematic reviews, both quantitative and qualitative, on this topic. One of the commissioned qualitative evidence syntheses is on patient perceptions of digital health communication, and I was part of a team that was asked to conduct this QES. And we'll come back and use this case study to help us unpack some of the questioning process. So what was very important for us when we were asked to do this was to understand who wants to know what and why. In the case of this QES, it was the reproductive health department within WHO commissioning the review, and they had already established an advisory group to help them unpack this big question around digital health and breaking it up into multiple pieces, quantitative and qualitative research. They've also done extensive internal as well as consulting externally with all the countries who requested this information. And they have already identified global evidence priorities and gaps. And the questions they were trying to identify through this process was, what are the most important questions that the countries want to know about? And how do they prioritize those questions? And what gaps of evidence provide the rationale for shaping those questions. And why? We also needed to know why are they asking this particular question with the end user and target audience in mind. In this case, it was policymakers who wanted to strengthen health systems for client communication. And although this was intended as a global evidence synthesis review, in our questioning process, it was clear that the commissioners had a particular interest in how this kind of digital communication could strengthen health services in LMICs, and we needed to keep that in mind when we were busy refining our questions. We also knew, and so did the commissioners, that there is a gap in evidence on patient perspectives of m-health and digital health interventions, and also that qualitative evidence was best suited to be able to address this kind of evidence gap. So I think the key lesson to take from what I've said so far and from our experience is that questioning and consultation is key. You need to consult early, you need to consult often and widely to sharpen your understanding of the purposes of the review, its possible audiences, and its potential impact. I'm now going to talk about some of the tools that you can use in refining your question. And I'm going to focus on using question frameworks, which some of you will know as Pico being one of those, and I'll show you a couple of those. But just to say, why should we use a question framework? It can help as a planning tool to refine your question. Conceptually, for instance, it can help to identify your question components. So I'll illustrate that just now. but just to give you a preview. In a Pico, for instance, you talk about population, intervention, comparison, outcomes, and each of those are components of a question that you need to be able to consider when you are designing your question. It all will then help you to scope the literature and evidence base for the question components that I've just outlined. Practically, it's very useful because once you've used that question framework, you then have particular concepts that you can plug into your search strategy. It also then helps you define what is in and what is out. For instance, the population, you might say, okay, it's patients, but what kind of patients? And the methods, you might say certain studies are not others. And the interventions, you might say it's this kind of digital versus not another. And then importantly, it then helps you to already from the start to up a data extraction form with some of those issues as your key concepts. And very usefully, it will become the basis also for your write-up of your protocol. So what does the question framework look like? Pico is familiar to people, and I will give you a bit more detail on that, with a P standing population, I for the intervention of concern, comparison that you're making, and the outcomes of interest. And often this is used for effectiveness reviews, but I think it can equally well apply to qualitative reviews, although alternatives have been developed that some people feel work better because the terms that they use are a little bit more flexible. So SPICE, for instance, talks about setting, perspective, intervention, or phenomena of interest. When you don't have a clear sort of intervention, you might just have an experience that you're exploring, comparison and evaluation, and then SPI is another such version of these question frameworks. So under Pico, under P, which refers to person, population, or patient, you're asking what is the problem that you're looking at. And in this case, we're talking about behaviors that can be improved through communicating with clients. And what is the specific population? We mentioned it's patients, but you know, we're going to look to see perhaps can we be a bit more specific on that. What intervention indicators are you looking at? So what kind of treatment changes are you looking at to explore? So we've seen in the question earlier that they're talking about digital communication. So under this area, we're going to perhaps need to ask more questions about that. Under comparison control, are the reviewer, the commissioners interested in us comparing this kind of digital communication intervention against standard of care, which might mean the absence of a digital communication intervention, or perhaps they want us to compare it to other interventions, so perhaps different ways of communicating with clients, such as perhaps giving them a phone call to remind them of adherence, or giving them targeted information when they come for their clinic visit. In terms of outcomes, you need to look at what is the review interested in assessing. And in our case, we're looking at perceptions, experiences, and so on. So are we looking at attitudes? Are we looking at identity barriers, and so on? And of course, we will need to ask the commissioners more questions of that. So I think at this point, I'm going to give you a chance to be the person who's trying to help me, the reviewer, to ask more questions of the commissioners. So the WHQES question started off being a question of, in its most basic form, what are patients' perceptions of digital health communication? A qualitative evidence synthesis. I'd like to ask you now to have a chance to think about whether you think you have enough information to proceed with your review, and if not, what clarifying questions would you like to ask of the commissioners of this research, and also of yourself as the researcher, before proceeding with the QES. And as a hint for you, you may want to think of the components of the Pico that we've just gone through. You might want to ask the commissioners for more information on those Pico areas. And I'm going to hand over now to Tamara, who's going to help people respond either verbally or through the comment boxes. Tamara?
Thank you, Natalie. So if you would like us to unmute you so that you tell us about your question, please use your raise your hand option, or you can just send us your question in response to the exercise in the questions tab on the right. Okay, so we have Huda. Huda, we unmuted you.
Hello, is that me speaking?
Yes, go ahead.
Yes, I'm actually listening quite well to the webinar. I think with the qualitative evidence synthesis, it's something like the barriers or something that I need to identify. This is one of the things that Karen was asking us to think about. So my question is actually not related to this exactly, but sometimes when we run the search, we might not get qualitative material, but quantitative. Can we also like merge this into the question? I think I'm not sure if I was clear or not. Let me just know.
Tamara, can I respond?
Go ahead.
Tamara, can I respond?
Yes, go ahead, Natalie.
Okay, Hoda, thanks for that question. I think that would be a good question to bring in at the end in the discussion time. But for the moment, if people have questions that they specifically want to clarify, that will help to clarify the question that I've put up.
So Natalie, we have input from Ari actually, and who's saying more detail on who the patients are, like age and gender.
Okay, so he is saying let's ask the reviewers to clarify who the patients are and specifically to clarify whether they're interested in this particular age and gender. Okay, so I'll keep that in mind, and we're going to take a couple more inputs and then I'll respond. So tomorrow you will let me know if there are more inputs.
So we have another question coming from Tirapon. What are the scope of the patient medical conditions?
Okay, that's also a good question. So I will need to ask the reviewers or the commissioners the scope of the patient's medical conditions. Okay.
The third
yes,
one.
I agree very much. Those both the question from Ari. Please define the patient demographics further, if possible, and the scope of the medical conditions of the patients. Those are two good clarifying questions.
So the second one was actually from Tirapon. So we have a third one coming from Iran, and it's what would be the intervention we are comparing against?
Okay, and another good question. What is the intervention? So she's talking about the I in the Picos, and she's also talking about the comparison, the C in the Picos. So I need to ask these reviewers whether they are comparing it against other, perhaps non-digital interventions or just against standard of care. Yes, absolutely. That would be a good clarifying question.
And I think the last one for now is from Huda, and it's maybe the type of communication.
Absolutely. So define the intervention further. The reviewers have said, the commissioners have spoken about digital health communication, and definitely one would want to know what do they mean by that, what is included, what is excluded. So definitely these are very good contributions, and we have had to ask the commissioners all these questions. And so what I will do now is show you what the question eventually looked like. And then I will also show you the application of that question on a Pico, indicating also to you how important it was for us to actually further define each of those particular Picos in the process of before we could start with the review.
So Natalie, we just have one last one, which is what about maybe also about the outcome from Khawla.
Okay, what was the question about the outcome?
What is the outcome?
Oh, absolutely. So in fact, people have actually pretty much touched on all of the Picos. And so what that demonstrates is that when you use a question framework, it can guide your questioning process and your clarifying process. And that's exactly what you've done right now. And that's exactly replicating what we have had to do. And I'll show you the outcome of that. So it went from a very simple question to a more expanded question, which reads, patients' and clients' perceptions and experiences this time of targeted digital communication. So targeted is included now, as well as what kind of communication that is accessible via mobile devices, for whom, for reproductive, maternal, newborn, child, and adolescent health, a qualitative evidence synthesis. So you can see in that under population, we now have a much more expanded set of information about who we're talking about. We're talking about reproductive, maternal, newborn, child, and adolescent health, and that also answers Ari's question about its mixed gender and its mixed age. But we also asked, we needed to know where are these patients, and we were particularly interested in primary healthcare services. And as I've mentioned earlier, upon further questioning, globally, yes, but more particularly, we want to capture, definitely prioritize also LMIC evidence. In terms of the intervention, we're talking about people, clients or patients receiving targeted digital communication, and we needed to define that with the commissioners. And so we're talking about SMSs, MMSs, perhaps even video links on, as long as you could get receive that on a mobile device like a mobile phone or a tablet, and that communication was specifically aimed at improving healthcare systems, like the healthcare communication system with patients, healthcare practices such as patients being able to have follow-up appointments, and outcomes such as changing adherence behavior. And what were we comparing it to? We were comparing it both to absence of digital health communication systems, but also possibly alternative interventions, such as perhaps versus phoning people to improve their adherence to visits, or giving them sort of reminder slips. And the outcomes were perceptions and experiences, which included attitudes on various things and barriers they might have facilitators that might have identified in terms of their views of such form of communication. And just to say that in the end, our results section of this review had 3 sections: acceptability, feasibility, and the third section was gender, equity, and human rights, because the reviewers or the commissioners were also particularly wanting to make sure that their global guidelines are going to address things like gender, equity, and human rights. So at this point, thank you for your inputs. Those were very useful. I'm going to just pause here a little bit and to say that we can actually end here and say that you've basically now seen how one can find a question, but I do want to just alert you to another method, an additional method. To help you refine and deepen your question, you can also use a conceptual framework. And often when one talks about conceptual theoretical frameworks, people's eyes tend to glaze over because they think it's very complicated, but it can be quite simply be seen as a thinking tool to help you unpack the different components of your question, very much as you've done now. But as in social science, when we do social science research and we start off with looking at how can theory inform our investigation, our questions, our analysis, the same process can apply for QES. How can theory or conceptual framework enhance your questions that you're searching for and also your analysis? So I'm just going to keep it as simple as possible, and we might need to have a separate seminar on logic models. So what does a conceptual or logic model help you? How does it help you with question formulation? It certainly can help you to surface the assumptions underlying your question, and I'll give you a very quick example. It can help you to identify sub-questions, and it can help you to prepare for using the framework as an analysis framework. Just very quickly, if you wanted to have, say, a a model or a theory around acceptability of new interventions in healthcare, it might look like something like this. So that is very complicated, but in fact, it's only seven dimensions of acceptability. And before you start your review, you might want to look at something like this and say, okay, I think my review is going to be interested in all of those things. Or if you look at the bottom, there's 3 different aspects of acceptability. You might say, well, actually, I'm not interested in prospective acceptability. I only want to know about people who've actually experienced an intervention and not about people who's perhaps involved in formative research. In fact, in our review, we ended up looking at also formative research because we found that a lot of studies did formative research and actually had quite useful qualitative information to contribute. But we chose not to use this because we wanted to have a very simple, just kind of, attitude feasibility kind of evaluation. But you can see how potential can be useful also in shaping your analysis framework. So I'm not going to go into that. That's a simple framework which you can read about later. And I'm going to end by saying that the lessons we've learned so far is that conceptual clarity of the review question is critical. Stakeholder consultation is necessary, but not sufficient, because ultimately the research team has a responsibility for clarifying that question. Sometimes prioritized health systems questions are not always feasible questions, and it's important and time-consuming steps to actually find that into a reviewable health system question. The final question may in fact differ from the one that was posed, both in focus and in scope, and therefore you need to go back to your commissioners and your users to check in with them. Finally, flexibility, ongoing stakeholder dialogue, scientific rigor are required when prioritizing reviewable questions for health policy and systems research. At this point, we'll stop and there's time for questions. If you want to read further, we've drawn on this fairly new paper that's come out this year that really gives a lot of detail about question formulation. But the floor is up for questions, and tomorrow I assume that you will moderate that.
Yes, definitely. Thank you, Natalie. So we actually have one question regarding the formulation of question. So is the following a possible research question? Why the NTDs disease, the non-tropical diseases, control programs are not effectively implemented in a selected study area? So could this be a research question? I will paste this now in the chat so that everyone can read it.
Is that I think
should we put that up tomorrow? Can we put that into a slide? Because I think it would be great if everybody could have a look at that, and then we can think about how can we translate, if a policymaker came to you with this issue, how do we translate that into a systematic review question? So can I do
Yes.
that? Is that right? Okay.
Yes. So I have the slide ready. Let me show it to everyone.
Are you gonna put it up?
If you would rather, so that you make comments on it, go ahead, please.
Fine, I'll just. So can you tell us the question again? It's why
Yes.
NCD control programs are not efficiently implemented, in particular
Study in
disease areas, or is it country areas?
Study area.
Not sufficiently, not effectively implemented in
Selected study area. So I am going to unmute Aaron to see if there's anything else to fix. Aaron?
In selected study areas. So I think we need to just ask for clarification on the last part.
Yeah, is it in a study area or in a health systems area? So it would be a health systems implementation area, say a health services area.
Hello, Aaron, can you hear us?
Yeah.
Aaron?
Yeah,
Okay.
you're unmuted.
Hello?
Hi, Aaron.
Yeah, the question is why NCD programs are not effectively implemented in a particular study area. Let's say, for example, we're picking a particular state, maybe Lagos State in Nigeria. Do you understand?
Yes.
Yeah, so
Okay.
that's the question.
Okay, so it's in fact in a particular system.
So we can just pick a
in
particular country if possible.
Okay.
Yeah. Okay.
Absolutely. In particular countries.
Yeah.
Yeah.
Okay.
Ooh, my spelling when
Okay.
it's on.
So what
Okay.
do you say his name was? Erand.
It's Erand.
Is it
Lanaj.
Erand?
Yeah.
Erand Lanai.
Right.
Okay.
Erand, so maybe we could ask you what kind of things what kind of question, if you remember the different areas of inquiry, feasibility, meaningfulness, implementation, equity, what kind of question, what kind of area of inquiry in QES do you think this might be?
Yeah, the disease prevalence areas for NTD, neglected tropical diseases.
So you're asking about effective implementation, right? So
Yes.
if we look at the domains we were talking about, we can ask questions on implementation. And then if we look at the set of questions that pertain to that domain, there are different questions you can ask. For instance, you can ask, what is the process of delivering the intervention or program? So you're trying to ask, is perhaps a difference in the way that people are delivering the program from how it's supposed to be delivered? What are the intervention components and how do they work together to produce the effect? What was the dose delivered? So you can ask questions about examining the fidelity of the delivery of these interventions. So is it does it have the correct coverage? Is it delivering all the components? And how did the participants or the people who are supposed to receive the NCD program, the patients, how did they actually respond to that? Could that be the reason why it's not effective? And then there's questions on what were the providers' experience of the project? What was the patient's experience? So this question is absolutely a QES question, and it can have multiple sub-questions. And so what is useful in a question like this is to begin to ask, to unpack your own assumptions and the assumptions in the literature and possibly in conceptual models about what is required for a particular NCD control program to be implemented effectively. And then looking at, can I ask sub-questions about those different components in my QES? And for instance, you could perhaps go to the SURE framework that I've put up and say, that's a framework that talks about the implementation elements of an intervention. And maybe I can ask then in my QES questions on provider experience, patient experience, organizational environment, and health systems functioning. But I'm going to have Karen also respond now.
Hi, sorry, is it current?
Just a clarification, a small clarification. Is NTDs, neglected tropical diseases, not NCDs? Just for clarification.
Okay.
That's okay.
Yeah.
Okay, so I don't know if you can see my screen, but if I were looking at that question, so then one of the things that I would think about is, how do I go from the particular to the general? Okay, so you're looking at I don't know if everybody can see but you're looking at in a particular country. Now, it's more than likely that you're not going to get information about that particular country. But if you throw the net wide, you might get information about multi-countries. Okay, there may be one study from your country, but not. So you want to look at places that are similar and that are different. So you're looking at this, you're looking at this question. Now we're looking at, what is it that we're looking at? NTDs, which is neglected tropical diseases. Okay, so that is your focus. You're looking at another aspect of it, control programs, which is another then part of your focus, your control program, and you want to know about effective implementation. Right, so I'm just finding another color there. Okay, so we're looking, and then you want to know another part of that question, which is your why part. Okay, so already if I okay, so already we have the why that you want to know. You've already got the particular area, neglected tropical diseases. You know in what you want to look at that as a control program. You know what you want to know about, which is effectively implemented, and in a particular country. Okay, if, as I say, you break this down, the particular country you may not be able to get specifics on, but you can, for example, if I were going to rethink this for qualitative evidence synthesis, some of the questions I might ask are things like barriers and facilitators. Okay, so there I will look at, okay, I'm still getting the red color, but I would look at barriers and facilitators. So I would look for primary studies that looked at barriers and facilitators. I would also ask about perceptions. How do different stakeholders perceive neglected tropical disease implementation? From that I can find, okay, so how do different stakeholders perceive NTD implementation, perceive
NTD control program
implementation,
perceive or experience NTD control program. Okay, so I'm just
and contextual factors as well.
Yeah, I'm just going to change this color here so that we. Okay, so I'll put that up again. Okay, so you can translate this question, which is probably going to come from your policymaker, and they're like, why in my area does this not work? Okay, so then you can then go to what you translate that. What is it that you want to know? What you want to know is, what are the barriers and facilitators to implementation? Perhaps you don't find it in your country, but you can ask a question about, what do qualitative studies tell us about barriers and facilitators in other contexts? Then once you have the information, you then translate that. You say, in a country that was very different to ours, these were the barriers and facilitators. But in a country, and so you've suggested Nigeria, so perhaps you might find a study that came from Ghana, or a study that came from Uganda, you know, somewhere where it may not be the exact same circumstances, but it's also an African country. So then you say, in that country, what is it that you find? Or, for example, you say, when we looked at this question, we found from qualitative studies where they were conducted in low resource settings, these are the things, these are the contextual things that people spoke about. Or, of course, yeah, so Natalie's telling me we have more questions, but I think that starts to show how, you know, how we translate a policymaker's question. Okay, I'm done.
Okay, tomorrow,
I'll take another one.
Tomorrow, if there are more questions, and then we also need to remember Hora's question.
Yes, so we have Hauda. Hauda, please go ahead. Hello, Hauda? Okay, so let's move to Jose. Hello, Jose?
We did write down Huda's question from earlier, so Natalie will come back to it.
Okay. Jose, can you hear us? Okay, and so we're gonna move to Ari. Ari, please go ahead.
Sorry, I don't have any question. I think it's by mistake.
Okay.
But it's nice to hear from you, Ari.
Bye.
Okay, and so maybe we can go back to Huda.
Yes. Hello? Yes?
Go ahead.
Yes, my question is actually because I'm looking at barriers to access medications in low middle income countries. So I put my question like the same idea where you were just mentioning earlier, the previous example. I wrote my question like, what are the barriers that hinder women from accessing essential medications, for example, for breast cancer? So the thing is, I even used the filters and everything, but at the end, I got all quantitative data, although my intention was qualitative evidence synthesis. So I was just wondering, is something wrong with the question, or I don't know.
Yeah.
And the question is, what are the barriers and
to
facilitators
to access to medicines
in low and middle income countries?
Cancer.
Okay, I'm going to write it up again
Yeah.
so that everybody else can. But your question, okay, so, but I mean, your question is it a research problem, or have they just not been? So what are the
barriers
and facilitators
to access cancer medicines for women,
medication
for women in LMICs.
So, Huda, what I can say from my experience in looking at access to medicine literature in general is that a lot of it is about HIV care. And it may be to do, and that's what makes systematic reviews important, because it does tell us where the gaps are. And it may be that there may not be literature on this. The other option is to change, then you start to rethink this and change, expand. So you might want to say something about what are women's perception about access to medication. Think about also this word access. Is it a limiting word? Start to play around with the word. What are the alternative terms that you can use? If cancer is particularly, might also be a limiting term. So people might have, I don't know, names for different kinds of cancer. Like leukemia, for example, might be a word that you want to throw in. I'm not a cancer specialist. I don't know all the words. But, you know, think about these things. If you're looking specifically for women, you might want to start looking for qualitative studies on just on women's experience of reproductive health, women who have had hysterectomies, that kind of thing. If in all your shifting, you find one study that applies, then look then at the related studies, and that's how you then start to build up what might, and look also in PubMed for that one study that you found. What are the terms that PubMed has used to classify that? And that might start helping directing you towards the qualitative literature. But there is a lot of playing around, I think, that has to happen right in the beginning.
Right. Yeah, I fully agree with Karen. You know, in this area, we have a problem where the question can be too broad and you have tens of thousands of hits, but you can also have a problem where the question is too narrow, and then you need to start getting creative, because it's possible that there are absolutely no studies on this specific question, but you need to think conceptually then, what related studies might actually bring me towards answering this question, even if not exactly answering that. So it might need to change. You might need to change the word cancer and so on. So sometimes you also need to look at similar types of evidence, which you might then want to translate towards your question.
Yeah, and I think that's quite important, because what we found, like, you know, because we had a question on access to medicine, And we wanted it for non-communicable diseases, but we couldn't find anything. All we could find is access to medicine for HIV. So then one has to apply. So you might say that the circumstances, the contextual circumstances, the same, but the disease is different. And that then, you know, one has to give your policymaker what you can, and try and give something rather than nothing, is my feeling. And say, this is not perfect. We didn't get it specifically for cancer. We didn't get it specifically for esophageal cancer, but we might have gotten it for for pancreatic cancer. So is there anything in here that is a lesson? But also don't be disheartened, because it's good to show a gap. I think, I mean, and I can say this because of our experience when we started, Natalie started her effectiveness review. There was a lot of anxiety. What if we get an empty review? But actually an empty review shows that there is no literature. And that's an important thing to show, because it means that we need more primary studies. So that's a very big, it's a very big finding.
Tamara, in terms of time,
and Huda's other question.
Yes. So, so it really depends on you, Natalie and Karen, but yes, our time is up. Would you like to answer the last question?
Yeah, we're happy to continue. If you could just restate the question.
It was a mixed methods
I think
question.
Huda had another question.
Yes, the only thing is, for example, if I run the search and then my intention was qualitative, and then I ended up with all quantitative studies like cross-sectional and so forth, but however the literature is rich with a little bit like answering the question, is how can something like that be tackled?
Yeah, I think that's actually quite an important finding, Huda, in the sense that what you're wanting to do a qualitative evidence synthesis, but you're finding that you actually some of your answers are actually lying in mixed method studies and also even in effectiveness studies. So, for instance, there might have been trials where people have actually described processes accessing medicines and gaps and so on. And so the question is the question, can you use that then in your qualitative evidence synthesis, which is a really good question. And I think Karen can better answer that than me.
So my feeling, so, you know, we've done a process look. We didn't end up publishing it, but Simon Loon and I looked at trials on breastfeeding, lay health workers and breastfeeding. And what you can do, there are some approaches like narrative review, but you don't even have to go to like really fancy. I would suggest that you take the study that you have and you look at what did they write about process and context, and you try and extract that information, because there is something there. It's, you know, you haven't got nothing. They may not give you the full information that you're looking for, but you can, you know, even in a trial, people tend to say, you know, I found the, well, it was very, this worked, but this particular thing was a barrier to full fidelity of the intervention, etc., etc. So I would say don't throw the baby out with the bathwater. Try and look for the contextual information in what you have, and start to build up some kind of picture from that. There is also a very nice paper by Lisa Fadenhauer that I can send to tomorrow. And tomorrow, if you just remind me, but on building context into primary studies and into systematic reviews, which I think is just a very important lesson for all of us, even when you're writing a quantitative primary study. Try and include contextual information, because people do want to know that. They don't only want to know the bare bones, especially if all they end up getting is one trial. People do want to know what happened around the trial. So,
Tamara, also just to tell people who are still online that we will be sending through you the actual presentation, and there are some references in there. So over to you.
Okay, wonderful. So thank you very much, Natalie. Thank you very much, Karen. This was a wonderful session. For any other questions, please feel free to contact Natalie and Karen, or just send them to me and I can forward it to them. Thank you all for attending, and stay tuned for the recording. We'll be sharing the recording within a week. Thank you.
Thank you for having us, and thank you to the listeners. Bye-bye.
Bye.
Bye.